if you're looking at, you've got the microbiome testing that you've done now, and then you've also got the food sensitivity testing. So how are you able to kind of identify then, what are some of the common things that people might be sensitive to, and how can you address it at that stage?
So these testing, the food sensitivity test and the microbiome testing, can take a lot of the guesswork out of the process of finding
Mhm.
out what is truly going on in your gut. Testing, it can help us figure out what are your specific food triggers that are causing inflammation in the gut. It helps us identify if there's any imbalances happening within the good and bad bacteria. Is there any overgrowth of bacteria, yeast, or fungus? And overall how your digestive function is. Are you producing enough digestive enzymes to break down your foods properly?
Mhm.
Um, I would say for food sensitivities, a lot of people, like you said before, they think the foods that they're having is healthy. They're
Yeah.
eating a lot more of those healthier foods, but they're still frustrated that they still have digestive symptoms. And so I would say the food sensitivity test gives us a lot more clarity and understanding in terms of what foods you're really sensitive to. So it does help us a lot when it comes to creating a treatment plan that is targeted and helps us really address those findings properly.
I find a lot of patients will say, I'm eating healthy, I'm not eating a lot of gluten. I found that I get bloating if I have gluten. And I think sometimes people don't realize that lectin, that's in so many foods.